Here are some notes on pharmacokinetic changes with aging. As you get older, you have changes in the pharmacokinetics of many medicines. Let's start with drug onset. As you get older, you have decreased cardiac output, which leads to a longer circulation time, which results in slower drug distribution and equilibration between body compartments. There might also be some contributing factor with your reduced lean body mass as you get older. Nonetheless, the effect is the same. Onset is typically slower in elderly patients due to decreased cardiac output. And this makes sense. If your blood is pumping around slower, it's going to take longer for the blood to get around your body and for that drug to have its onset. Now let's talk about the other ways to eliminate or metabolize medicines. Hepatic metabolism is decreased as you get older. This is a result of reduced hepatic blood flow and slower hepatic enzyme activity, leading to prolonged drug effects for medications cleared by the liver. And I have a lot of examples here from the neuromuscular blocking agent class. So rocuronium and vecuronium, for instance, have prolonged drug effects because they are cleared by the liver, or at least partially cleared by the liver. Next, renal elimination also decreases. You have reduced GFR and renal blood flow as you get older. This is at least partially because of decreased cardiac output, but also because of other factors. In any case, this results in prolonged drug effects for renally cleared medications. An example is pancuronium, which has almost double the duration of action as you get older compared to when you're young. Butyrylcholinesterase activity is another way to eliminate drugs. This also decreases with age, leading to prolonged duration of drugs like mivacurium. This does not significantly affect other drugs that are metabolized by butyrylcholinesterase like succinylcholine, but some drugs are affected. This is an enzyme that's present in the blood. Hoffman Elimination is another way for drugs to be metabolized. This is minimally affected by aging, unlike the others here. This makes drugs like cisatracurium more predictable in elderly patients since this pathway doesn't depend on organ function. So in the end, to summarize, this explains why most neuromuscular blocking agents have a similar weight-based potency in elderly patients compared to young patients, but with slower onset and longer duration of action. And again, the exception was Hoffman Elimination's cisatracurium.